Hello and welcome to the Unbound Medicine webinar titled Integrating Technology in Nursing Education. My name is Brian Carey, Vice President of Marketing here at Unbound. The webinar will be about 40 minutes, and we may have some time at the end to answer questions. The webinar is being recorded and will be posted to the Unbound Medicine website shortly. You will also be emailed a link to the recording. First, let me tell you a little bit about Unbound Medicine. Unbound Medicine builds digital products that answer clinical questions at the point of need. With expertise in medical informatics, health technology, and medical publishing, our team has delivered innovative mobile and web solutions to hundreds of healthcare institutions and over 5 million individual clinicians over the past 17 years. Our speaker today is Dr. Kathleen Williamson. Dr. Williamson is the Chair and Associate Professor of the Wilson School of Nursing at Midwestern State University. Throughout Dr. Williamson's career, she continues to promote the integration of technology and evidence-based practice with healthcare professionals and educators through community partnerships, workshops, conferences, and educational coursework. She has integrated technology solutions at several major institutions throughout her career and is here to talk about her experiences. At this time, I would like to welcome Dr. Williamson and turn the presentation over to her.
Thank you, Brian, and welcome everybody to the presentation on integrating technology in nursing education. And I'm here to take you through everything that has to do with integrating technology and offer you some suggestions. And so today's agenda is, why do you need a technology solution? Ways you can integrate that technology, challenges and experiences with technology integration, and at the end we'll save some time for questions and I'll make a conclusion. So basically, why do we need technology solutions? Well, we know that that technology, we use it all the time in our daily lives, and we need to, find ways to incorporate that technology. We know that providers use technology in the healthcare system, and in order to stay up to date on the latest and most accurate health data and health information, it's an opportunity for us to start integrating that into our students and putting that technology into the students' hands. And so we also, have an opportunity to change the way we do things in the academic setting and in our classrooms, and we want to be able to translate that into our clinical setting. And so it's kind of like the coach and the players. And as a coach, that's our responsibility as a faculty. We're the motivator. We call the plays. We work with the students to get them to understand and learn what we have to do. And they are the players, and they need to complete that play, and they need to move forward on that goal of figuring out where those resources are. And so, as I say this, that technology really is the tool that can help motivate students, and we have to look at those outcomes and see if those outcomes are being met in our classrooms as well. And sometimes they're unexpected outcomes. And one of the things we want to achieve is clinical reasoning or critical thinking, and using technology and those tools help promote a student-centered environment. As nurses, though, we do play a vital role in the care of patients, and we need to make sure that we have access to the most credible evidence information that's available so that we can make decisions about that care that we are going to provide, or the students will be providing to the patients. Students have to have a venue to access information, and that needs to be through simulation activities and also in their clinical settings, but also in their classrooms. We need to make sure that that information, we vet that information so that we know that the students are receiving that current up-to-date information. And there's various ways that we can look at that. And so, like I said, up-to-date information through various portals such as Medline and Journal Access. But we also need to make sure it's quick. We also need to make sure it's user-friendly. We also need to make sure it's easy to use. We want to help develop that critical thinking and having confidence to be able to make those decisions, and giving them an opportunity to practice making those decisions, such as through case studies in the classroom or simulation activities in a simulation center. But as faculty, some of the issues are in the literature, particularly talk about as faculty, could also be a barrier to this, and that might be the way faculty, their attitudes towards technology, their use of technology. The millennials and others, they've grown up with having technology, in their hand. They have a phone, they have a computer, and so as faculty, though, we have to think of opportunities and ways we can integrate this into the learning, but also into our instructional learning activities. Nursing stats, we know that a lot of information is no longer in print, that we access things virtually and we access things through our databases. But in order to stay up to date, it could be reading so many journals every day just to stay up to date, 365 days a year, just to be able to read and understand everything that's out there. And so one of the ways that we know we're getting information, as you can see by the stats, that nurses own their own smartphones. We use apps every day in our daily routine, be it a social media app or checking your email, or if you're on a program that tracks your walking distance and your steps and so forth. We use them all the time. They've become part of who we are in our life, everyday life. We use smartphones to communicate with colleagues about patients. 52% use smartphones to get information instead of even asking a colleague, which is interesting because previous data showed that we really would ask a colleague instead. So who is our learner today? How do we know that they're learning? What do they need to know? Where do they learn? And how can we continue to support them in our classrooms and have them be productive nurses in the setting? And so some of these things are what we want to do with technology. We have to think about technology as just a tool. It's not a learning outcome. And so the left side of the screen talks about the wrong answers. And it's not about making the presentation or creating a blog or a Word document. It's really about the things that are on the right side, and that we want to raise awareness, maybe through a simulation experience. Maybe you want to have them access the resources during that simulated experience to raise awareness on how to utilize and access those resources during that experience. You might want them to start a conversation or be collaborative or take action, but drive change in some way. So those are more in relationship to how technology can be used as a tool to get the students to engage and learn in the classroom. And also, mobile technology or other types of technology can also enhance the students' effectiveness in the classroom setting. But one of the things that's important to note, and I've done some research and read some research, is that mobile devices and technology alone, we have to make sure they're easy to use, and also the usefulness of it, because we know people will not use technology if it's difficult. Technology use in various settings come from opportunities to say, how can it be used in the classroom, like I said, or the clinical experiences. We want them to be able to have access to this information so that they can help problem solve, use a collaborative environment in which to learn from each other. And we want students to be able to use higher order thinking skills to be able to make those judgments when they're in the clinical setting and maybe through case studies in a classroom. So ways that we could integrate this technology, I'm going to take you through some models and an opportunity to say, how can I pull this together in my own classroom? So integrating technology, well, we have to look at the task. Is the task through one of these, through simulation, problem solving? Through some tools, we can look at some applications on devices or the different devices or the virtual learning environments, maybe through your learning management system, and creating a student-centered environment in which the learner can engage in those activities, and we can then measure those outcomes to determine that the student has met them. And I like the picture that's on the side that says, technology is just a tool. It can be used crudely like a hammer or skillful as a scalpel. And that is so true, because technology, it's kind of a love-hate relationship, and that, it is always around for us, and we have to figure out how to incorporate it into our particular classrooms and make it a part of what we do versus something that we have to do. And we know that healthcare providers use technologies in a variety of ways in the healthcare systems, and they do it to improve outcomes, to reduce cost, and improve efficiency. And many organizations have gone to electronic EMR systems and use decision support systems to have access to the latest and most accurate information wherever they are. We know that it helps promote communication and coordination of care, which also improves workflow. All of those things too can help us in our classroom and improve our student outcomes, enhance the engagement of students in our classrooms to then be better team players when they leave us. But the most important thing is that curriculum drives the use of technology. Doesn't matter if you're training, using it for professional development, or working on incorporating it into your classroom. It's a real, like I said, a conduit to the activity that you want. The technology isn't the activity, it's the outcome of that activity and what the expectation is. And this is a very good model to think about as far as how we would actually integrate the technology in regards to our pedagogy and our content. And we want to be in here in this square, or triangle, sorry, in this triangle. And that when we look at the integration of the theoretical aspect of it into practice, we want to make sure that we are flexible and that we utilize knowledge to successfully integrate technology into our teaching. And that the content section over here is about that we use the knowledge that we have about the subject that is going to be learned or taught. In the pedagogy side is the teaching. It's that deep knowledge about the processes and practices or methods in regards to teaching and learning. And the technology component is really thinking about and working with technology and how it applies and how we can apply those tools and resources in our classroom. And we need to use it effectively to be productive, and we need to adapt to those changes when necessary. The SAMR model is the other model that I would like to introduce you to, and the SAMR model provides us an opportunity in which to think about our activities that we do in our classrooms and how we can move it from an enhancement, from the substitution to augmentation that does lead to learning and enhancement and engagement, and move it toward transformation, where we really look at transformational learning and we move the use of technology from modification to redefinition. And an example of that would be taking a short paper in your classroom. Well, at first maybe we would handwrite it, and that would be from handwriting it to putting it on pen and paper and pencil, and then moving it to a word processor would be augmentation. Same assignment, just different delivery, end product being, instead of written, it's now typed. Well, moving it to modification would be taking that same paper and putting it in a word processor, but possibly putting a text-to-speech function to it, or having the students blog and give feedback to that assignment. And then the redefinition would be to completely take that assignment and create it in a very different and new way. Maybe you would have the students make a video on it. Maybe you would have them do a voiced-over PowerPoint presentation to then sit there and explain it in further detail, and having students peer review. So we've taken an assignment that has just been paper and pencil, of writing an assignment that was only between the student and the teacher, to moving it now to include and be collaborative with others and enhance that and transform that learning. Wanted to share this with you because the SAMR model has been linked to the Bloom's taxonomy, which allows us to create the objectives that we have in our classes and our programs. And so you can see where substitution and augmentation is really on the lower end of Bloom's, where it's really remembering and understanding, where that modification and redefinition and using a piece of technology to modify the assignment or redefine it really takes it up into that analyzing, evaluating, and creative areas of Bloom's taxonomy, where we would like students, and we know that's where a lot more critical thinking and collaboration and thought processes and thinking take place. So here's an example that I have for you. So substitution is an ACT direct tool. Teaching and remembering, teaching by lecture supplemented by presentation software instead of those old transparencies that we used to use. Augmentation is about applying and understanding. Well, maybe by teaching by lecture supplemented by a presentation software, and maybe using a classroom response system would be taking it to the next level. Well, here teaching now is redefining this task. In this case, it would be having students work together in an using interactive technology to analyze and critique a completed project. And then redefinition would be having students working together using that interactive technology to create and solve a problem. So these are some questions to think about, and I've put up here this PDF, access to this PDF pedagogical wheel that was created where you take SAMR and Bloom's taxonomy, and it links you to various different apps that you can have access to that will help move the use of technology and possibly give you some ideas. So there's that link for you. And what I want to leave you with here on the SAMR model is, what will you gain by replacing the task with a new technology? What features improve that task? and how does it change significantly, and will it allow for creation of that new task to be previously inconceivable, and would it enhance the learning and the student engagement in your classroom? There are various applications that we can put into place in the classroom, and there are many out there. And so a couple of them include those that are proprietary and that have a fee for them. Some of them are very medically driven, and many aren't really nursing focused. Some of them are free, which are nice, and then there's a product called Nursing Central through Unbound Medicine. And in this feature, it really is an integration that allows one as an educator to explore alternative ways that we can use digital technology in our classroom. We can use it through case studies. We can ask questions of what and the why. Why was it so important to know that if the sodium level is a certain level? That's great, you can look that up, but what does that mean? How do you, now we can ask questions on higher order thinking questions, and we can really look at assessment and implementation. Are the students able to assess and implement effectively? So challenges that come with integrating technology. Well, there are many, and many could be in relationship to, does it really work in my classroom? It's also attitude of the faculty and how the faculty will perceive using technology, and we have to really have conversations with our faculty about that. But it's also about the learning pyramid, and we know that trying to learn using this is often presents barriers, and then if you're going to lecture, sometimes it's just easier to just take out that PowerPoint and lecture in your classroom. But what about those online environments? We want to be able to get toward the bottom of this pyramid where it's effective learning. Requires a great deal more of having group discussions, demonstrations, practice by doing, teaching and learning, see one, do one, teach one kind of concept, and that we know the more the students practice, the more they do, the better they'll know, and the more they'll understand, and then the more they'll learn, and then the better that they will be within our classroom settings. Technology, integrating pedagogy and technology, that TPAC model really does demonstrate that there is deeper learning that takes place. And through the technology integration, we can extend learning, we can increase student engagement, but first and foremost, we must now look at our own teaching, and we may have to adjust what we do. And in that case, that's not always easy for faculty to do that. Mobile devices, how do we use them in the clinical setting? Well, in some clinical settings, you're going to have to learn what the clinical settings rules and regulations are. Can they use them in there or can they not? It might be a conversation with them and talking about what policies that you can put in place in your organization that will assist with that integration. How about increasing student technology fees? In our case, we did not increase our fees, but in our case, we put that fee onto the student so that they can access it by use of their financial aid or through the bookstore or other ways. So those are ways that you're going to have to work within your own organization and figure out the best ways in which it would be most effective, most economical too for the students. We also have publisher commitments. You might be very committed to various publishers in your organization, and integrating technology. A lot of publishers now are putting things together and bundling things, and so those are conversations that you're probably going to have. But it's also a time commitment, and really making sure, working with your IT department and others and those champions who are early adopters of technology to help with that integration and getting an understanding of what is and how to use the technology, and then getting faculty comfortable with it. A lot of faculty, when they're in their classrooms, they don't want to feel that they could try something out, because if it doesn't work and so forth, and the students will, they might say the students might not look fondly on that. And so it's an opportunity to maybe get faculty to practice in somebody else's classroom and help them understand how to use it effectively so they can feel comfortable with it. And then just like the various comfort levels. Just like we asked for anything else, we didn't learn how to ride a bike either by the first time we sat on it. And so sometimes we just have to take opportunities to practice and give faculty that opportunity to do that through different workshops or having them come to the classroom when no students are in there and testing out the tools that are going to be available. Our challenges too are really who is coming to our classroom. The students are very comfortable in many cases with technology, but they're comfortable doing their day-to-day operations, emails, checking their social media accounts, Snapchats, things of that sort, so Twitter, but they might not really know how to utilize their computer and or access various apps effectively unless we teach them. And so that's where that creativity comes in. We really need to be creative in helping them have access if it's Nursing Central, practice using it in the classroom, asking them to take it out and use it through maybe a case study or question and answer times in your classroom. It allows us to actually enhance content. If we know the students can have access to it, have them access it during class, talk about it, so then we can move on to higher level, more involved content. Again, engage the students in the learning process. One way that we've done this is in the clinical setting in particular, is that at the end of the day, some faculty say, it's great, I asked the students, how did they use the technology today to access what they were doing in the clinical setting? And so the students were able to share how they're using the product in various ways so that they can share with other students and learn from them as well, as the faculty will learn too. And that sets up collaboration, because now we can have a conversation about what's going on too. And it sets the stage for faculty in the how and what technology to integrate in their teaching. And remember, it's about the learning, and it's about in learning the content and the outcome, not so much the technology. So if we utilize that framework, either one, the TPEC model or the SAMR model, and we can learn to find alternative ways to employ that technology to enhance our learning, and we can adapt to that technology in a manner that is effective and the faculty feel comfortable with it and the students will feel comfortable with it, we would see an increased engagement and possibly student learning and problem solving activities. That would be a great research study to do, and then work progressively to increase that Bloom's taxonomy and move it up the ladder. We know that there are competencies identified in all health professions, and the IOM is just one that put the report out about using evidence-based practice and quality improvement and using informatics. And in nursing in particular, we know that we have the essentials, and I'll talk to the BSN essentials that say 3 is scholarship of evidence-based practice. We need to collaborate in the collection and documentation and dissemination of evidence. And I'll just speak to Nursing Central in the sense that we can actually access Medline, and you can actually do searches either on the computer or on their device. When you're in clinical, you can look at table of contents from different journals to teach students how to read titles, read abstracts, and possibly then go get those articles. And then we also have another essential called information management application of patient technology. Here we can build knowledge and skills using decision-making support tools, and then we can really integrate the use of technology in the classroom setting, simulation, and clinical, and give the students the opportunity to have it in the palm of their hand, information right then and there. Again, they're not having to guess. They can look it up and hopefully make good decisions. Technology impacts healthcare. 40% of information found affects the way we deal with our health, and 90% say they would trust medical information shared by others, and 19% have a health app on their phone. And this is very important in the sense that, you know, we want to make sure that if this many individuals are using devices, we do need to make sure of the safety and the security, and that we're following the regulatory regulations that have to do with the use of devices and technology in the various settings that we're in. Most important is making sure that the students aren't violating any HIPAA regulations, and that we make sure that we maintain patient privacy and confidentiality in those settings. And that's why it's a really good conversation to have with your students, having a policy, but also making sure the facilities that you go to understand what your policies are, and also having a conversation with IT if that's appropriate. Technology impact on healthcare is that 54% of patients are very comfortable with a provider seeking advice from online communities or to better treat conditions. We know the individuals out there are really evidence-based consumers. They're coming in if they have information about their process or the disease process. They're coming with their information. They're looking up on websites. And that we know that 31% of healthcare professionals are using social media for professional networking, but the last one sticks out in that 60% of professionals use social media to follow what other colleagues are sharing and discussing. And just hope that it's not about patient information, but it is an opportunity for us to be at that higher level and transform the learning, and that we really are getting it from all different areas, and it's not so much because we've always done it that way. That really is changing. So I'm going to leave you with an opportunity to think about choosing a particular project, or maybe a project or an assignment that you already have in a class. Pick that topic from a class that exemplifies a subject that you love to teach. And is there a topic that students get stuck on or have difficulty with, or what I would call have a muddy point? What is it that you want to have them understand or know that will help them in the future? And then from that, what will they gain by replacing that activity with technology? Is there added improvement to that task to be accomplished? And will it demonstrate more varied critical thinking and improvement and student engagement and outcomes? So I ask you, what's in your toolbox? Thank you very much for this opportunity to share this information with you. Thank you, Brian.
Thanks, Kathy.